if you're looking at a bell curve, probably 50 to 60 is when people start really noticing. And by 65, a lot of those folks have said, okay, it's now or, not now or never, but I've been thinking about it. I'm ready. It's time. I've got time in my life and what have you. But there are folks that come in even as early as their 40s that have had some skin changes, particularly in the neck area is where we tend to see things start presenting earliest. The neck skin is challenging, it's thin, we move our heads a lot, and we can't be as aggressive with non-invasive treatments like lasers and peels on the neck as we can on the face. The neck skin just doesn't heal quite the same way. And so we're a little more limited as to how sort of aggressive we can be in those neck treatments. And so we end up with that being what sort of tends to be the first thing that folks notice, and then often some heaviness around the jawline or the dreaded jowls start to show up, and that's where folks often are starting to come in and just say they notice they feel like their face has slid or has dropped, or all of those kinds of things. As far as for the face, as the cheeks sort of lose volume or the volume starts to drift down, the jawline becomes heavy, what have you, then it's a facelift. And I tend to tell everybody that a facelift basically works from the cheekbones down to the neck. It includes the neck lift component, and it allows me to sort of get some of that weight off of the jawline, reposition sort of fat pockets that may have slid forward on the cheeks and down around the corners of the mouth and on the jawline and what have you, and pull those back up to a more youthful position, tighten everything up, and then I just sort of sweep out the extra skin. That's a facelift, and it's amazingly not particularly painful. It's just emotional to have your face operated on, and so it takes, a couple weeks before you feel like you're presentable. And, a lot of times people are doing a little bit of computer stuff from home or what have you after a week because they feel well, but they're just not quite ready to maybe show themselves. But even so, you see the results the day after when the bandage comes off. You can see a change, and it's really impressive. So there are some things that we can get rid of little fatty pockets under the chin that are non-surgical. In our office, we utilize Kybella and cool sculpting as ways to remove fat. The Kybella is a series of injections, or sort of a grid of injections of a medication that dissolves the fat in that pocket. And then cool sculpting has a little attachment head that sort of chills the skin and fat in that area, and it causes the cell membranes to alter, and eventually the body will kind of break down those little fat cells over the course of a couple months. Both treatment options take a couple months to see the full results. Sometimes people need a couple of treatments. I'd say often people need a couple of rounds of either of those treatments, but they're both generally effective against fat. They don't do a lot for skin. And so that's where, from non-surgical standpoint, things like radiofrequency microneedling, certain laser treatments can be used to sort of refresh the skin if that's the issue.